Okay guys, the last topic of this unit is going to involve the joints. Okay, and a joint is where we have two bones coming together, or where two bones articulate. And when we're saying articulate, what we mean is how two bones interact with each other. Okay, so we have three broad categories of joints in our body. We have fibrous, cartilaginous, and synovial. Now these joints are where bones join together. They don't always necessarily mean that there is a lot of movement associated with the joint. For example, the first one there, a fibrous joint, these joints are where bones come together, but they're held together with tough fibrous connective tissue, and they're often referred to as fused together. So when we're talking about a fibrous joint, we're talking about no movement whatsoever. And we'll see examples of fibrous joints in the skull, for example. They join the skull, a lot of the facial bones together, as well as we'll see this in the pelvic bone. Another term we use to describe a fibrous joint is synarthrosis. The next type of joint is not quite as fixed as a fibrous joint. There is some motion about the cartilaginous joints, but again, not a whole lot of movement. So these joints are held together with layers of connective tissue, and we describe them as slightly movable. And the term that we use for it is amphiarthrosis. Now, this is the type of joint that we would find in the vertebrae or in the ribs. Now, these type of joints occur in places that we do need to have some form of movement, but at the same time we want to have everything quite stable and rigid so that it provides a ton of protection. So our rib cage, for example, our thorax, that needs to expand in order for to ventilate our lungs. So when we inhale, it gets bigger. When we exhale, it gets smaller. But it needs to have a very small range of motion for that to happen. Ideally, we want to keep those bones where they are because it provides a tremendous amount of support to the lungs and the heart. And the last class of joints are the ones that you're probably more familiar with. These are the synovial joints. And another term we use to describe these are diarthrosis. These are joints that have a cavity between the bones, so there is space between the bones, and they're the most well known. These are joints that are movable, so a typical joint like in your fingers, your elbows, your knees, shoulders, and your hips, these are all going to be synovial joints. Now, what does a synovial joint look like? Well, if we look at these pictures here, the cavity of the synovial joint, if we look down here, is going to be that dark blue area in between where the two bones come together or articulate. In that cavity, there's going to be a fluid called synovial fluid, and that's going to act as a lubricant, and that's going to provide some cushion, some support, and lubrication, so that the joints, the point where the bones come into contact with each other, it's not scraping or hard impact. The bones actually move across each other smoothly without being destructive. At the surface of the bones, where the bones come together, there's going to be a smooth layer of cartilage that we often call articular cartilage. Articular cartilage just means that this is where the bones articulate against. It's kind of difficult to see in that picture because it's quite small, but the articular cartilage right here would be between the head of the femur and the bone on the pubic bone that holds the femur in place. So another thing about the synovial joints is those joints are going to be covered in ligaments. So there's an encapsulation, or they're encapsulated by connective tissue that hold the joints in place, but those connective tissues are flexible enough to allow for movement about those joints. Now, movement about the joints is different depending on what type of synovial joint we have. So on this slide here, we get a look at 6 different types of synovial joints. We have the gliding joint. So this is a case where bones slide over each other. Not a whole lot of movement, but enough movement. And we'd see this type of joint in your wrists and your ankles. So the tarsals and the carpals. The next joint is the hinge, and these are probably a more common joint. We'd see this in your elbows and your knees. You'll also see it in your jaw to a certain extent. The pivot joint is going to be one that allows rotation. So an example of a pivot joint is going to be in your neck at the axis. The C2 is C3 basically. We have another type of movement, or a type of joint, certainly called condyloid, and this is going to be the bones will allow movement in two different directions. So if you think about your index finger, you can move your index finger forward and back, and you can move it left and right. You can move it laterally. That's an example of a condyloid joint. The next one is a saddle joint, and this is similar to the condyloid joint, but it's going to be a much deeper articulating surface. So you get kind of a similar range of motion, but it's the anatomy of the joint that's a bit different. So you'd see this at the knuckle of your thumb. And then the last one there is a ball and socket joint, and this is where we get the head of a bone. Generally we see this at the shoulders and the hips. So the head of the humerus or the femur fits into a socket that you'd have in the hip or in the pectoral girdle, and it allows for rotational movement around a center pivot. Now, from these different types of joints, we can have these different types of movement. Now, in most cases, these movements will be antagonistic. That means one is the opposite of the other. So flexion or extension, those are going to be two opposite movements at the same joint. Pronation, supination, abduction, adduction. Circumduction is by itself. We get dorsiflexion and plantar flexion, or inversion and eversion, and then we can also have rotate. So these are all type of movements about a joint. So in this picture here, in this slide here, what we're doing is we're looking at these different types of motions. So flexion and extension is probably the most common one. Flexing of your muscle is generally, it pulls it towards the body. So on this side here, we're going to have the flexion, and on this side over here would be the extension. Pronation, supination, this happens when a bone radiates or moves around another. So if we think about the wrist, if we turn our wrist over so your palm is up, that's supination, and if we turn it over so that the palm is down, that's going to be pronation. Abduction or adduction is when we lift or move a body, move a joint towards the body. Abduction is when we lift the body up, so this is going to be abduction here, and then adduction is when we move the arm back towards us. So let me just clean that up a bit better. Sorry. Moving the body away is going to be abduction, so A, B, and then moving it back towards your body is going to be adduction, so A, D. Circumduction is pretty clear. It's a rotational movement or a movement in a circular motion. Dorsiflexion or flexion, that's going to be movement of the ankle generally. So dorsiflexion is going to be going this way, where the toes come towards the tibia, and plantar flexion is going to be when you point your toes away. Inversion, eversion, again, is another movement around the ankle. Inversion, of course, is when you point your toes inside, and then eversion is when you point your foot to the outside. And rotation, that's what we'd see at the head or the neck, where we can rotate the head around a pivot. So those are all just pictures of those different types of movements that we talked about on the previous slide. And the last topic in this is going to be talking about some of the disorders we can have with the joints, some of the things that can go wrong with our joints. And some of these include a herniated disc, which is a disc in the back, so the pads between the vertebrae. These can become damaged, or we can have small ruptures in them, and it makes those weaker, and it can cause a whole lot of pain. We can have dislocation of the joints, so the bones aren't articulating in the way that they should be, or they should, and this often involves a doctor putting them back into place. You can have a sprain, of course, which is an injury to a joint. You can have arthritis, which is inflammation, and we'll talk about arthritis in the next slide. You can have slipped disc, which is when the disc is slightly out of line, so the body of the vertebrae doesn't exactly match up with the disc anymore, and this is a very painful condition. And then you can have common backache. These are all things that can happen in relation to joints. Okay, one of the most common joint issues we can have is arthritis. And arthritis is an inflammatory condition that occurs around the joints. And we classify arthritis into 4 different categories. The first one that we see there is osteoarthritis. And osteoarthritis results in just basic wear and tear as we age on the skeleton and the joints. So over time, joints can be degraded through injury, through repeated stress, through conditions where we get loss of bone or loss of synovial fluid, and as a result of that, the joints become inflamed, they become tender, and they become quite difficult to use. And this is a result of overuse or use during aging. The second type is rheumatoid arthritis. Now, this is a pretty serious one. This is a result of autoimmune syndrome. Now, autoimmune syndrome is when your immune system will attack yourself. So in this case, the immune system will attack the synovial membranes that are associated with the joints. Now, as a result of that, those membranes get damaged and then they heal. And as they heal, they will start to add extra membranes and tissue. So the joint becomes quite swollen, and it can look like it's enlarged. If you see somebody, an older person, with the joints of their fingers, they look really, really big or knobby. That's a sign of rheumatoid arthritis. The third one there is septic arthritis, and that occurs when we get bacterial infection of the joint. And bacteria, when they cause an infection, of course, they increase tension or pressure in the joint space, in the synovial cavity. They can create waste that's built up there, and it can result in an infection, and it can cause problems with the articulations of the joint. The last one there is gout, and gout is a result of a metabolic condition where we don't process protein as well as we should, and it results in these crystals of uric acid forming in the blood, and they end up getting lodged in the joints. And it's basically like having little shards of glass in the joints. It's usually found in the big toe or maybe the knees, lower in the body, or it can happen in the fingers as well. And it's a very, very painful condition. It can be controlled by medicine, but it can also be controlled by avoiding foods that cause this type of protein metabolism, where we end up with an abundance of uric acid. Now, we can get to a point where joints become so damaged that they need to be fixed surgically. This can happen from injury, it can happen from arthritis, it can happen from other degenerative conditions, but we get to a point where joints need to be completely replaced because a person's suffering a loss of quality of life. So this condition is called arthroplasty, and it's basically we take the bone that's been infected out and we replace it with fresh bone and a new joint. So it's a pretty invasive surgery. It's a major surgery. We're dealing with rods and pins. If we look at this figure here, you can see this patient's had a hip replacement. So it has replaced the joint, so the socket part of the hip, as well as the head and the neck and the top part of the femur. All of this has been replaced with either metal or plastic components, and this will make the patient much more comfortable over the long term and give them back their range of motion. And then the most common one we'll find is just common backache. And backache can be caused by a lot of different things. It can be caused by disease of the vertebrae. There can be disorders of the discs. You can have disorders of the abdominal pelvic organs, and this can all translate into pain in the back, strains in joints of the lower sacrum. All of these things can result in backache. And backache is severe because in the workplace it causes a lot of missed time for workers, and it's something that we can usually prevent. Most of the time now we focus on prevention of back injuries, and it's the actual opposite of what is being pictured here on the cartoon. When you lift stuff, now you try and use your back as least as you can, and you focus most of the strain on your legs, which are much more strong and better created for hauling heavier loads when you compare it to the muscles and the vertebrae in your back.